Thank you so much. And I take it, yes, that you're going to advance the slides. This is really an exciting presentation to give. And if you go to the next slide, I just want to talk for a moment about the partnership, although Richard has done it already. Our function is to support TCCY and organizations like it. And it's really exciting for me to come and talk to you about what we've learned over the past 2 years, because one way to look at the many changes that have happened is that we've learned that policy matters, that the decisions we make about serving our children and families have a big impact on their lives. So if we go to the next, and I want to share that with you and with all of the organizations like yours around the country. So if we go to the next slide, I think we all know that the last 2 years have been really turbulent. And what we've seen is that the pandemic, the associated recession, and the policy changes that were driven by those have caused massive fluctuations in child well-being over the last 2 years around the country. And just to flag some of those changes, as a result of the pandemic and of course of businesses closing up or people, being laid off, family finances fluctuated enormously. But it wasn't all bad news, which people don't always realize. When the pandemic first hit, unemployment benefits that were created federally were so high and stimulus payments were so high that we actually saw a reduction in poverty around the country, but not for everybody. We saw them for people who were eligible for those benefits, and the unemployment benefits were eligible for many people who would not normally have been eligible, like the self-employed, through federal funding. But the people who were not eligible for unemployment, even through the new programs like undocumented immigrants, they were much worse off and they were in crisis. Once those benefits were ended in August of 2020, poverty and hardship started to climb. And then in July of 2021, families started to get monthly child tax credit advance payments, and we saw a big drop in family hardship. And then when those payments ended in December, what we're seeing in January and February is that hardship is starting to climb again. So the pandemic created a huge change in child well-being, but so did the federal policies that were enacted. Another big fluctuation in child well-being was the inconsistent access to schools. Schools went remote, schools would open and then shut down as they had COVID exposure. This was challenging for all students. Remote learning was really a problem for many of them, but it was particularly problematic for children with learning disabilities. We've also seen enormous mental health challenges. Our whole mental health system now is just overwhelmed. The wait lists to see anyone, whether you're using Medicaid or private insurance, are enormous. But for children, there are a couple of particular factors. They certainly were exposed to the overall anxiety and fear around the pandemic. The isolation of doing school remotely was a problem. But for some of the children, actually taking school from home was an improvement, particularly kids of color, who many of them found that was less stressful for them because they were less exposed to racism among both their teachers and their peers. The other source of trauma and pandemic trauma for kids was that many children lost parents and caregivers, or they experienced pandemic trauma because they were afraid of that, because a parent or caregiver or just a sibling, another member of their family, was very ill for a long time. So that's created a huge mental health problem for children. And another big fluctuation in child well-being that I just kind of want to flag for you is the giant crisis that's created in the childcare industry. What we saw initially was that many childcare programs closed down right away because when parents weren't working, they couldn't pay for childcare, and the childcare programs didn't have the resources to pay their rent and stay open. Some of the government programs halted some of that slide, but as parents went back to work, it was inconsistent. Schools were trying, childcare programs were trying to serve kids with lower teacher to student ratios. What we've seen is a reduction in the number of child care organizations that are available. I think the current estimate is that we've lost about 30% of our childcare industry. And even when childcare programs are open, their care is unstable. So one week kids go to childcare and the next week the school doesn't have enough teachers to keep their room open because the teachers are sick with COVID and at home. This is really unstable care for children. It's a real problem for them. And of course, it also either prevents the parents from working or reduces their engagement in the workforce when they have to work from home or take time off. So it's been a very turbulent time for children, with some high points and a lot of low points. Next slide, please. So I want to share two different ways of assessing how kids are doing with you. And the first is by looking at the federal poverty measure for 2020. We don't have data on child poverty yet for 2021. But in 2020, we had the official poverty measure, which is the poverty measure that we have used for decades, which looks at cash income for families and does not subtract work expenses. And using that measure, 11.6 million children, which is 16% of all our children nationwide, were living in poverty in 2020. And that was an increase of more than 1 million children since the year before. And it won't be a surprise to know that Black and Native American and Latino kids were more likely to be poor than non-Hispanic, white, and Asian and Pacific Islander peers. But if you take a look at those numbers, those are really high numbers, no matter what group you're looking at, deeply troubling numbers. But we have a second poverty measure, which is called the Supplemental Poverty Measure, also produced by the Census Bureau. What's different about it is that it looks not only at cash income, but near cash income, in-kind benefits like food and housing assistance, safety net benefits like the Earned Income Tax Credit, the stimulus payments, and it also subtracts out work expenses. By that measure, kids were actually better off in 2020 than in 2021. We saw poverty by that measure dropping 3 percentage points and 2 million fewer kids compared to 2019. Stimulus payments and the refundable tax credits lifted 4.6 million children out of poverty in 2020. This is a big shift. We started the supplemental poverty measure a decade ago. And throughout the last decade, when you looked at work expenses and supports, the poverty measure, the supplemental poverty rate for kids was always higher than the official poverty rate. But for the first time in 2020, the official rate was higher than the supplemental. In other words, for the first time in 2020, the value of government programs was such that it made poverty drop significantly below, poverty measuring in-kind benefits dropped significantly below poverty at just looking at cash income into families. That's a giant change, and what it tells us is government policies really can make a significant change in family financial circumstances and the well-being of children. Next slide, please. The other way that we can look at poverty and how children are doing in general is because we have a new data set from the Census Bureau. And this is a really exciting new data set. It's considered experimental. It's called the Household Pulse Survey. And the Bureau started it, and I want to give them enormous credit for this, within weeks after the pandemic started. And it's currently authorized to go through October of 2023. It's really different from all the other surveys that the Census Bureau conducts, because what it does is it gives us essentially real-time information on how children are doing. The prior slide showed you how kids were doing in 2020. The Household Pulse Survey, which does not measure poverty, but does measure hardship in various ways, gives us data that was collected only 2 weeks before. So it is collected in a very different way. They send emails and text messages to people. Because they use that technology, they cannot reach everybody. They can pull their sample from about 95% of the country. That does mean that they are missing some of our worst off populations who do not have internet access. And that is unfortunate. It is somewhat less accurate. But on the other hand, it tells us what's happening right now. And they produce the data right now every month based on 2 weeks of surveying. Early in the pandemic, they were surveying every week and releasing data every 2 weeks. So what that did is showed us the rapid changes in child well-being and child hardship as policy changed or as things changed in the pandemic. It's unique in the way the Census Bureau works. And they've also been updating what they collect. So we've been able to get information on different things over time. Next slide. So this shows you the data they're collecting right now, and you can see it covers a really wide range of factors that show us how kids are doing. It covers whether they got their child tax credit, which of course in January and February they didn't, but also how they used it. It covers whether people are vaccinated, their use of transportation, energy, whether they're getting rental assistance, and also whether they're behind on their rent and at risk of losing their home. They also have behind on their mortgages. It looks at their access to education, to childcare, to K-12, and to higher ed. It looks at family employment. It looks at whether the family has enough food, whether they can cover their regular bills, and it looks at physical and mental health. So it lets us look in real time at how kids are doing. And I've pulled just a couple of indicators to give you a sense of how kids were doing February 15th of this year. Next slide, please. I pulled the February 15th data. It was actually collected the last week in January and the first week in February, because they're just wrapping up a cycle and they're retweaking it a little bit, and the new data will be coming in a couple of weeks. But all of this data is just looking at households with children. In the last week of January or the first week of February, 40% of US households were struggling to pay their usual household expenses, and Tennessee was about the same. Among households with children in the US during that period, 13% sometimes or often didn't have enough to eat. And in Tennessee, that's 15%. And when we look at households with children, almost 22% were not caught up with their rent, which means they're at risk of eviction. In Tennessee, that's actually a little lower, just under 20%. Next slide, please. We also can see that kids are having very inconsistent access to childcare because of concerns about safety and care. And unfortunately, the survey doesn't really define that. So it's hard to know if what they're worried about is kids getting exposed to COVID and bringing it home, insufficient staffing. But what we saw in that survey was that around the country, of households with kids in them, children under 5, 30% were not able to go to their childcare setting because the family was concerned about the child's safety and care. Tennessee is a lot lower, but it's still profoundly high at 17%. I should add that the survey releases data nationally and for every state, and then I think 15 major metropolitan cities, and I don't think any of the cities are in Tennessee. For the slightly older kids, the kids who go to school but who need before and after care, the concerns about safety are lower at 20% and 15%, but still really disturbingly high. The picture we get is of kids never knowing where they're going to be, losing contact with their caregivers and with their friends, or having very intermittent care, very unstable day-to-day experiences for children. Next slide, please. So that household pulse survey really gives you a sense of what the hardship looks like. What I didn't pull, but want to tell you, is that the hardship really dropped a lot. The number of children in households where there wasn't enough food, or where they were risking eviction, or were struggling to pay everyday expenses, dropped was pretty low at the start of the pandemic when the unemployment benefits were in place, rose when the unemployment benefits ended, dropped significantly in July of last year when the child tax credit monthly payments started to go out. And now that those ended, all of those measures of hardship are starting to rise again. The connection between our public policies and access to supports and child well-being is made very clear by this new data set. And I encourage you, if you use data on child well-being in your job, to check out that household pulse survey, because it is really they've done a nice job of making it very easy to use to go see how kids are doing. But it also makes the case for something that child advocates around the country have been saying for a very long time, which is that policies make a big difference in how children do, and that when families get access to supports, they use them to feed their kids, to pay the rent, to pay regular expenses, to take care of their families. So that's been one of the closest links we've been able to make between data and child well-being and public policy. And that's really a big development as a result of the pandemic. There are some other measures of how kids are doing that I want to share with you. I want to talk for a minute about children's access to health care. And of course, a key factor in that is access to health insurance. What we know during the pandemic is that the access to public health insurance improved enormously during the pandemic. Children's health insurance and Medicaid or CHIP grew by 11.4% during the pandemic. And as a result, more than half of all the children in the country are now insured through through Medicaid or CHIP. I don't know what that means for the total insurance rate because we don't have data on what happened to private insurance coverage. We don't know how much of that dropped. And as a result, that's why Medicaid and CHIP enrollment grew. We don't know that because the Bureau couldn't conduct some of its surveys during the pandemic. And so we have a data gap in the American Community Survey, and they were not able to release their usual one-year American Community Survey data, which tells us the insurance rates by states. So that's the good news. Kids seem to have maintained access to healthcare through insurance. But the concern I want to raise for you is we don't know what's going to happen next. We think that this July, when the federal public health emergency is likely to be terminated, or whenever it's terminated, we're guessing at July, or estimating July, states at that point have to start figuring out if the people on Medicaid remain eligible. Until then, under federal law, the states were required to maintain the coverage and not look at eligibility. When the federal public health emergency is over, they're going to start looking at eligibility. And we think 37 million children are protected by that continuous coverage requirement. Once they start checking eligibility, kids might lose their health insurance one of two ways. They may have become ineligible for Medicaid and have to transition to a new source of health coverage, maybe buying it on the exchange or something like that, but they might not make it to that new source. Or they might remain eligible, but a lot of people, when there are procedural reviews, lose their health insurance. The notice to prove that they're still eligible gets lost in the mail, something happens in the processing. The Georgetown Center for Children and Families estimates that 6.7 million children are at very high risk of becoming uninsured during this eligibility determination period once the public health emergency is over. And to give you a sense of how much that is, the last year we have data for kids' health insurance, which is 2019, there were only 4.4 million children uninsured in the United States. Presumably there are still uninsured children today. We might add to that group of uninsured children 1.5 times as many of all children that were uninsured in 2019. So while they're insured, I don't know what it's going to look like a year from now. That's very worrisome. Next slide, please. The second measure, of course, of children's health is, do they get to the doctor even when they're insured? And early in the pandemic, WellChild Visits dropped dramatically. What that means, of course, is kids didn't get their vaccinations, they didn't get appropriate screenings and referrals, and they didn't get the kind of advice that doctors give parents to help them keep their kids healthy. The routine immunization rates are coming back, but it's been slow. And we also haven't seen the flu vaccination rates that we would have liked to have seen during the pandemic. I wasn't able to find the most current data on that for you, but the statements are recent and from the AAP. So there's a lot of concern that these delays in vaccinations may result in secondary outbreaks like measles because of diseases that are preventable by vaccines because the kids didn't get insured. So that is a real issue, is getting kids back on their WellChild visit schedule and getting them back up on not just COVID vaccines, but all of the traditional vaccines that they need. Next slide, please. Another big area of concern for kids is learning loss. I don't need to tell you that access to in-person school has been very erratic. We're just starting to see the data on how students fared as a result academically. I pulled some of the recent data. The data is coming from different places. There was actually a big article today with other data, all of which confirms that we saw a lot of learning loss. And I've tried to give you two different ways to think about the significance of that learning loss. One is that this kind of learning loss measured by this particular study could mean that the child has $44,000 less in expected lifetime earnings if we can't help the kids make it up. Another way to look at it is for kids in grades 4 and 5, they need an additional 8 to 10 weeks of instruction to bring them back up to where we would have expected them to be before the pandemic. Not to get them all the way to grade level, right? Many kids are way behind grade level, just to get them back to where they would have been if there was no pandemic. And for kids who are a little older, where instruction is more complex, for reading, they would need an additional 14 weeks, and for math, 19 weeks. So I think one of the big agendas for my organizations around the country is going to be figuring out how to help deal with this learning loss problem and get kids back on track academically. Next slide, please. So that's how kids are doing. There are many other things I could have looked at. When you are a multi-issue child advocacy organization like TCCY, you sometimes feel like you're responsible for tracking everything because kids are affected by everything. But I want to turn now to talk about some of the resources and supports to help kids do better. And there are a number of resources out there that states have access to that they can now invest in kids. There are dollars for investing in K-12 education, higher education. There's a set of money that's called Fiscal Aids for states and localities, which gives states pretty wide discretion in how they address the problems and the needs that occurred because of the pandemic. There's money to provide rental assistance so families aren't evicted. There's 2 different pots of money to try and support the child care industry. Those are not dollars that can be used necessarily to make up the bigger, longer term lack of access to childcare, which Congress is still trying to figure out if they're going to put any money into. Those are just sort of trying to get over the pandemic problems, and probably not even enough for that, but at least there's some. There's money for nutrition assistance, much of which actually comes federally and isn't under Tennessee's control. And then there's a whole set of expanded tax credits for families. But to get those, families have to file a tax return. And that may sound obvious, but in fact, many of the families who need this money the most have incomes that are too low for them to normally file a tax return. And because they're called tax credits, they assume they're not eligible because they don't pay taxes. That's not true. A family that made 0 earned income last year can still file a tax return and get these credits. We're talking about families that were getting by on unemployment insurance, families where the parent is disabled and they're living on disability benefits, families where grandparents living on retirement are raising their grandchildren. Those families need to be educated that for this year, there are expanded credits available to them that they can claim, that they must file a tax return. And so my organization is working with my members around the country to try and get the word out to these lowest income families, because it's a lot of money. They nearly doubled the value of the child tax credit for young children. It went from $2,000 to $3,600. Older kids went from $2,000 to $3,000. So a family with 3 kids could be looking at $10,000 in the child tax credit. But most families are getting that credit because they routinely pay taxes. They got the advanced credit. They still need to file a tax return to get the second half of the child tax credit. They probably will. But if you work with these lowest income families, I strongly encourage you to figure out how to help those families understand that even though they don't normally file taxes, they really should do it this year. And you don't have to be a tax expert. You have to get them to your local VITA sites, volunteer income tax assistance sites, which provide free tax experts through volunteers for low income people. And what you can see, I think somebody just put the long link up for my bit.ly toolkit. But we created a whole resource. We're doing a project with the Coalition on Human Needs. We created a whole toolkit with flyers and posters and messages you can record on your answering machines and texts you can send out and recorded announcements that schools can send out on, if they do those automated phone calls. Lots of resources, an FAQ, lots of information that should make it very easy for you to help those families access those dollars and really get a big increase in their income this year. And if you're interested in doing this, check out our toolkit, but also sign up for our email list, because as we have new resources to help you do this, we'll email them out. And I gave you the separate bit.ly for that. And Jennifer is kindly putting those links in. And we really encourage you to check them out, but they're also in my slide, which you will get after this meeting. Next slide, please. I do want to talk a little bit more about the federal fiscal aid to the states. Tennessee has $3.8 billion that the state can allocate. And then there's 3 other pots of money that go to big cities and little cities, and I think a capital budget. So the total amount of dollars coming into Tennessee is over $6 billion, just to sort of address the pandemic generally. You can use it for responding to the COVID emergency and addressing its economic effects. That can be help to households. It could be paying people to help families file for their income tax credits, which would then bring more dollars into the Tennessee economy. It's a really good strategy for bolstering the Tennessee economy. It can be help to small businesses like childcare programs. You can use it for premium pay. You can provide government services if your tax income's been reduced because of the COVID. And you can also use it for things like your infrastructure. This is separate from the infrastructure bill, which I'll talk about in a moment. So you can use it to do things like replace lead pipes for your water system, which obviously has permanent improvements for children when you do that. You can't use it to pay, fund pensions, and you can't use it to cover costs because you enacted a tax cut. But you can transfer to private nonprofit groups to fill all these services. So I encourage you to look at how your state is using those funds to help support families through the challenges of the last 2 years. Next slide, please. And then there was the infrastructure bill, which got passed last November. And it also has resources for investing in transportation, in water systems, in energy, in broadband, in cybersecurity, in disaster response. I know that Richard got our email last fall, which lifted up lots of the ways that it can benefit children, but I want to really emphasize 2. One is that using the money that the $15 billion is obviously national, not Tennessee, but doing lead water line replacement has a permanent benefit for kids. One of the things I was astounded to learn a number of decades ago is that when a mother has been exposed to lead, the lead builds up in her bones. And when she's pregnant, her body pulls the lead out of her bones instead of calcium, and the infant gets exposed to it. So the more you get rid of lead exposure to children from the water lines now, it's a one-time investment, but it benefits children for generations. So I encourage you to think hard about where you can use those funds for lead line replacement. The other thing that can make a huge difference for kids is expanding access to high quality broadband, because even now that kids are back in school, communities, particularly rural communities with weak broadband, the kids suffer because they can't do their homework. And then, of course, if we have schools closing and opening and online learning remotely, the broadband also helps with that. So I want to just lift up those 2 pieces of the federal supports in general that you may want to look at, because they can really help kids. Next slide, please. Everything I just talked about is law. It's there. It's done. But I also want to talk to you a little bit about a bunch of different pending federal legislation that we expect over the next weeks and months that will make a big difference for children and families. The first bill that we're going to see, which will probably be passed by March 11th, is the money to fund the federal government and all the monies that they pass down to the states for the rest of fiscal year 2022, which is called 2022 appropriations. Those was due October 1st of last year, so we're more than 6 months late. But they have finally reached a negotiation breakthrough by deciding the total amount of money for both domestic and defense spending. And they're very close to voting on this bill. This is the first bill in over a decade where we didn't have appropriations caps. And so the total amount on both defense spending and domestic spending overall is going to go up dramatically. So you're going to see significant increases in many children's programs. And I have not seen a good breakdown of what they've negotiated. They've been still negotiating the specifics. The one thing I will say is that there seems to be a big fight over whether to extend the authority for the Agriculture Department to make waivers on child nutrition programs for another year, which everybody thought was going to be in there and was going to really make a difference for school meals for kids and summer programs. There's now a glitch over that, and I encourage you to watch and see if that waiver gets extended for a year or not. But I expect this bill, they're going to try and vote on it now to get it done by March 11th. If they really run into trouble, after all, that's only 3 days from now, it's possible they would do one more short extension and then pass the final bill. But I really do expect them to finalize the budget as opposed to just continuing to flat fund everything, in part because they know that the military can't do what it needs to do around Ukraine unless it gets the increased spending that would be in this bill. So that's the first bill to watch for, and that's going to come down in days. Once that's over, the president will propose a budget. The president's budget is not binding. It just shows you what his priorities are and what he'll fight for. And then Congress will start working on fiscal year 2023 funding, which in theory should be in place in October. Don't hold your breath. It may be like this year where we operate on flat continuations of funding for months while they negotiate, particularly because it's an election year. But that will be the next process. You've also probably all heard a lot about the president's proposal to pass Build Back Better, which was what we call a reconciliation bill in our DC jargon, which means that it can be fast-tracked and only takes 51 votes in the Senate instead of 60, which means that it could be passed entirely with Democratic votes and doesn't require Republican ones. That had been negotiated for months. There were very comprehensive proposals to look at extending the child tax credit, making major investments in childcare, in pre-K, in climate change, many other things, a lot of health investments, and also raising taxes to pay for it. It was a fully paid for proposal. Negotiations with Senator Manchin from West Virginia, because they need every single Democrat, broke down in December. They had completed successfully negotiations with the other senator that was willing not to vote for it unless she got what she wanted, which was Senator Sinema from Arizona. And those negotiations stopped for several months, but they have just picked up again. And by just, I mean a couple of days ago. So I do think at some point you will see a bill. It will not be called Build Back Better. It's clearly important to Senator Manchin that it not carry that name. But what it will likely have is tax increases and reductions, healthcare provisions and reductions in pharma costs that will also provide federal revenue. That revenue will get used for climate change provisions, for reducing the federal debt, and possibly a 10-year investment in one or two social programs, but not the wide range of programs that were under discussion. I don't expect to see that bill finalized for another couple of months. They're just starting it, but I do actually think it will ultimately happen. These are things you've probably all heard about. But what isn't seen as much is that there's a lot of bipartisan stuff that happens in Congress that isn't controversial and that gets moved along. And so I wanted to lift up 4 for you, but I also want to mention that unbeknownst to me until I heard it this morning, the Senate is voting today on a bipartisan proposal to reform the post office and reduce its debt and give it a lot more capacity to do good mail service. So, that was happening smoothly. I mean, there was a lot of negotiations. It wasn't smooth for everybody, but it was a bipartisan process. It's going to get 60 votes in the Senate. Republican senators will vote for it. Other provisions that I expect to pass on a bipartisan basis in the next few months, the Child Abuse Prevention and Treatment Act and the Family Violence Prevention and Services Improvement Act will be bundled together. They will clearly pass. It's not exactly clear when, but it will be bipartisan legislation. The Federal Home Visiting Program, which is called McV a lot of the time, expires in September. I think there's a really good chance that it will get reauthorized on a bipartisan basis. You may have heard that the president had proposals in his State of the Union around mental health, but what you probably don't know is that the Senate Health Committee, Health, Education, Labor, and Pension Committee, has a bipartisan effort right now to look at mental health with 5 subcommittees, one of which is looking at youth, children and youth. And I do expect to see some kind of bipartisan legislation around access to mental health services. There's a new campaign launching called Journey to Success to try and improve the federal supports for youth aging out of foster care. I expect that to get bipartisan support, although I don't know that it'll happen this year because it's just starting. So there's a lot that's happening that you don't hear about that is bipartisan, where your delegation, whether they are Democrats or Republicans, can have a real impact. And there's a lot of other children's programs, such as the Child Nutrition Program, that in theory should be reauthorized, which is when they actually look at the program structure and revise it. And that's not likely to happen, but they'll just keep funding the current programs through temporary extension. And I just want you to know that any of those could bubble up and suddenly we'd be dealing with reauthorization for child nutrition or education for your kids with disabilities. Various other things could bubble up over the next few years, but we'll keep getting funded in the meantime. Last slide, please. I did want to take 1 minute to just let you know where your Tennessee senators have influence, because I don't think it's obvious to people in the states where your senators are likely to be able to make a policy change. So the first place they can make a policy change is any legislation, and I'm talking just about your senators now, because in the House, almost everything can pass just with Democrats, and so the discussion is entirely within the Democratic caucus. But in the Senate, there's two kinds of bills where the Democrats and the Republicans work out bipartisan solutions. The first is appropriations bills, which require 60 votes, so they require at least 10 Republican votes. And the second is any other legislation that needs 60 votes, which will end up being bipartisan. So that CAPTA, the child prevention legislation, is going to be bipartisan, and many of the other things I mentioned before. Anytime legislation is going to be passed in what we call regular order with 60 votes, your Republican senators are in a position to influence it. They're also in a position to have influence on the committees they sit in. And so I pulled for you the committees your senators sit on that have an impact on children and youth. Senator Blackburn sits on Commerce, Science, and Transportation. And there's two ways that committee is important for kids. The first one is they've got jurisdiction over the Census Bureau, which means they have jurisdiction over the ways the Census Bureau collects data on children and families. And the second, of course, is that the consumer protection and product safety has, kids need consumer protection and product safety, and she sits on that subcommittee. She also sits on the Judiciary Committee. She actually probably won't have a decisive vote on judicial appointments because those do not require 60 votes in the Senate anymore. They only require 50. But it does mean that her committee has influence over juvenile justice legislation. So you can think about talking to her about that. Senator Hagerty sits on Banking, Housing, and Urban Affairs, which also has a role around consumer protection. The Senate allocation of jurisdiction amongst committees is very strange sometimes. And it obviously has influence over how the federal housing funding programs work and transportation. And he sits on the Appropriations Committee, which decides how much money different programs get. And the Appropriations Committee is broken out into, I think it's 12 different subcommittees, each of which has funding control over certain agencies. He particularly sits on Commerce, Justice, and again, that's going to affect money allocations to the Census Bureau and the data it produces, and also the judiciary and juvenile justice. So those are the things that I hope will help you as you think about the year to come, about the state of the child in our country, and also the federal developments that will influence what you can do for your kids here in Tennessee.